Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're talking about emergency room care and what you should know before you go.
Medical Monday, sponsored by East Cooper Medical Center.
All right, Theresa, we're going to start off today talking about actually your background. You've been here for quite a while. What made you choose East Cooper?
I've been at East Cooper since March of '86, and it is in my community. I grew up in Mount Pleasant, so I wanted to be in my community and work in my community.
What would you say some of the biggest changes have been over the years that you've seen in healthcare in general?
In healthcare, especially for East Cooper, we moved from a much smaller hospital up the street to this hospital in April of 2010. And it's just much bigger. We have a lot of new equipment, and we're better able to take care of our patients.
Let's dive into emergency care. I mean, as far as that, what type of changes have you seen when it comes to the emergency room?
We see patients with a variety of illness, so sometimes not so severe and sometimes severe. And we can get them to where they need to be as quickly as possible, and I do like that.
Well, that's a good transition into the difference between coming to the emergency room and maybe going to someplace like an urgent care. What would you recommend when people are trying to think about where should I go?
For urgent cares, anything minor symptoms, cold symptoms, congestion, maybe a rash you've had for several weeks, any minor lacerations, abrasions, or contusions are definitely an urgent care capable injury. If you have anything more severe, especially a severe injury, a fall, you can have a lot of complications from a fall, so it would be important to come to an emergency department for that. Any chest pain or especially stroke symptoms, a lot of times in the community, patients will have difficulty speaking, or sometimes they just can't put a thought together or can't articulate, and they don't realize that that could be a stroke symptom and that they need to get to a stroke center. Not just any hospital or urgent care. It's very important to get to a stroke center if you're having any kind of stroke symptoms.
And you are a stroke center, correct?
We are a stroke center, yes.
Okay. Let's talk about the wait time. I know that's a big issue for some people because they think if they come here, they're going to be waiting for hours. What would you say to them?
Typically, our wait time is not long. It may be 20 minutes some days, but for the most part, we utilize immediate bedding. So as long as we have a bed in the back, we will bring patients in the treatment room. And they do not typically wait long to be seen at our emergency department.
And as far as using technology, setting up an appointment, what's the process for that?
We do have available on our webpage a link to a site that will allow patients to set an appointment time and actually show up at that time and be brought back. This would be utilized especially for patients with migraines that, it's difficult to sit in a loud, well-lit area. They could make an appointment, be brought back into a room immediately, and we could take care of them quicker.
Okay, and speaking of coming here, word on the street is people are now starting to take an Uber here. Have you heard about that?
I have heard about that. I read an article about that recently. And it's important for patients to know when it's appropriate to take an Uber, definitely for minor symptoms, cough, congestion. Don't get into an Uber if you have a fever or a stiff neck.
And we had a terrible flu season, so obviously going to the urgent care might be a good idea to begin with, but obviously if it gets worse, maybe this is when they should come see you, correct?
Absolutely, absolutely. And definitely don't take an Uber if you have chest pain or any stroke symptoms.
Alrighty, well, thanks so much for having me.
Thank you for coming.